Now back home, and the New South Wales Premier is determined in his approach to living with COVID despite cases rising rapidly. Jessica Maggio is live in Sydney for us. Jess, a new national record has been set.
That's right, Andrea. The Premier has essentially said this is life under COVID despite cases rapidly rising. That new national record saw 12,226 COVID infections in the past 24 hours. That's from 97,000 tests, which is a significant drop than the previous 24 hours, which was 158,000. Despite that, the Premier is insistent that the state will continue moving forward alongside the virus. At National Cabinet today, he's expected to ask his state and territory counterparts to join him in removing the PCR test requirements for international travellers. He says that he'll ask Victoria to join him even if Canberra refuses to do so. Authorities are reminding residents, as PCR testing remains inundated, to only get a PCR test if you're symptomatic, if you are a close contact, or if you are requiring a PCR test for travel. As you can see behind me, the line here at West Pennant Hills is absolutely huge. It goes for about 3 kilometres. It opened at around 8 a.m. this morning and closes at 12 p.m. But we've been told that at 11:15, what you see at that top hill will be cut off. So anyone that's behind that, which is about 2.5 kilometres long, will be told to turn back. Some of these people have been waiting 3 to 4 hours this morning for a test. We spoke to a few at Castle Hill who said that many said that they weren't actually there getting a test because of travel prerequisites, but instead because they were asymptomatic.
I think it's 2.5 hours now, yeah.
And are you getting tested for travel or are you symptomatic?
My family's are symptomatic. I'm a close contact, so we're just all getting tested just to be safe, you know. But yeah, better safe than sorry.
2.5 hours.
And are you getting tested for travel or?
No, because I'm not well. Yeah, positive rapid antigen test.
Well, actually, we came yesterday around 10 o'clock and we were told saying no more because so many cars already there. Then we drove to Stanhope Gardens, that was closed. Then I think we went to Parkley, that's closed as well. So I wonder as to why the other centres are closed. If they're open, I think then the queues would be less.
Now, authorities are asking residents to rely on rapid antigen testing, but of course stock has been flying off the shelf and there is limited supply. We've been told that they will see supply back in pharmacies and chemists around mid-January.
I can confirm that in our warehouse in Sydney, we do have millions of tests, and about 250,000 tests go out every single day. We're working very closely with the state and the federal government to get millions of tests in the first quarter of the new year. So January, February, March, there'll be millions more tests coming into Australia.
Now, New South Wales Health has also specified that if you're a close contact, you'll only have to receive a negative result from a PCR test until you can reconvene in the community. There are 746 cases in hospital at the moment with COVID-19. 63 are in ICU. There's also been 1 further death. Authorities are really stressing that the number of people in hospital with COVID-19, a majority of them are unvaccinated. So they're reminding anyone who can receive their booster shot to go out and do so. Around 85% of the population that is eligible to receive a booster has done so. They'll also assure residents that hospitals are well prepared, they're well equipped, they can deal with the current rate of infections that have been admitted, but they're certainly monitoring that number.